Welcome back. Now, to date, 291 Department of Correctional Services officials and 85 inmates have died from the COVID-19 pandemic. And to curb the spread of COVID-19 at correctional centres around the country, the Minister of Justice and Correctional Services, Ronald Lamola, will today launch and commence the vaccine rollout program that will see inmates and correctional services officials vaccinated at 90 approved correctional centres. And this happens while concerns have also been raised by some members of the public as to what is perceived as special priority being given to offenders incarcerated over law-abiding citizens. So to talk about all of this, we're joined by Chrispin Phiri, a spokesperson for the Department of Justice and Correctional Services. Chrispin, thanks so much for your time. Welcome to Morning Live.
Good morning to our viewers, and thank you for having me.
So far, 291 Department of Correctional Services officials and 85 inmates have died from COVID-19. How dire is the impact of the pandemic on the Department of Correctional Services?
Well, we've definitely not been spared by the virus. As you correctly allude, we've lost a couple of officials, a couple of hundred of officials, and just under 100 inmates to date. And we really need to ensure that at least we take all the measures possible to ensure that our correctional facilities are not super spreaders in any way. As you would know, correctional facilities have very limited ability for one to physical distance because of their institutional nature. And so it is a space where the virus can really find expression in a very bad way. And it's something that we need to ensure as the department that we are able to have under control, because correctional centres in and of themselves can become super spreaders in our communities, as you would have seen in the beginning of the pandemic, when officials had contracted the virus from a funeral. It quickly became a dire situation in one of our centres in the Eastern Cape. So there's a symbiotic relationship between our communities and our correctional centres. And that's why we really need to ensure that in our correctional centres, we do all we can to contain the virus.
So rights organizations, I can imagine, asking at this stage about the rights of inmates when it comes to a pandemic, which is not something that we deal with every other day. But just in that regard, how do you ensure that the rights that they do have are not trampled upon?
Yeah, on the contrary, it's something that we do deal with on every other day. And the Constitution applies to everyone alike, and even inmates. So in this instance, inmates have the right to the same quality of healthcare that someone on the outside would have access to. This is because, as you would know, we don't send people to our correctional centres and condemn them to death. We send them to be corrected. And in that process, they do have to get access to the best possible facilities as possible, as would anybody else in a normal situation. So in this instance, this is what we are trying to do. Section 35 of the Constitution, which speaks about one's dignity, that's what would be at play in this regard, ensuring that we really apply the dignity that is required to everyone who is in our custody.
And I would imagine rather difficult to do given the overcrowding situation. How bad is that situation currently in correctional services centres?
Yes, so to date, we have about 140,000 inmates across the country in 243 centres. So overcrowding is an inevitability to some extent, although according to world standards, our overcrowding is actually quite well managed at this rate. But it is still nonetheless quite a problem insofar as managing the pandemic is concerned. So we have to do all we can to ensure that all the protocols that we have in place go a long way in addressing physical distancing, as limited as it is, but also ensuring that the inmates that do come into our facilities from a remand perspective, those who are remanded or those who are new in our facilities, we ensure that they're adequately screened so that once they are eligible to mix with other inmates, we have taken all the precautions to ensure that indeed they are COVID-free, but also our officials who are conduits in and out of our facilities may carry the virus in our facilities as well. So strong protocols are in place for them as well, so that we are able to screen them and ensure that they are also COVID-free. And to some extent, the alert level 4 regulations as they stand now have been a great help because although with its own detriments, inmates are now not allowed to have visitors. And that goes a long way in reducing the spread of the virus because we would know that this virus is carried by people. So at least now we have a very strong mechanism in place to ensure that we limit the possible ways in which the virus can find itself in our facilities.
So you say that inmates are not allowed visitors at this stage. With regard to their everyday activity within the facilities, how has this pandemic and the alert level that we're currently on in the third wave affected that sphere of their lives?
Yes, those activities are quite managed now. Of course, they would not be able to do most of the activities that they would normally do outside of a pandemic. But we have now ensured that, for instance, the times to which they go out are limited, but the activities that they can do are limited within a particular period of time to limit the spread of the virus, even in our facilities.
So vaccination for the majority of correctional services officials commenced last Thursday, Chrispin. How many officials and inmates do you hope to vaccinate during this phase, and how many of those have already been done?
We've started on the 15th of July, quite correct, with most of our officials. A significant number thus far, within a short space of time, have already been vaccinated, and we really hope that a lot more would also take up the opportunity to get vaccinated, because this would protect not just them, but also protect inmates, as well as the families that our officials interact with, as we know that this virus is really rampant, even amongst our community members and even particularly amongst families with the Delta variant in particular. So thus far, we looked at, I think, approximately 1,500 in a short space of time have been vaccinated, and we hope to increase that quite significantly because we have a staff complement of about 40 or for over 40,000 staff. And we're then also looking to ensure that we vaccinate all of our inmates, those who are eligible those who choose to take it up, because of course it's voluntary. No one will be forced to take it up, as is consistent with the rights of individuals. So we're looking to vaccinate all of our inmates, and we also need to ensure that amongst our community members, but also even in our facilities, we work very hard to bust vaccine myths, because those are a deterrent. Even in our communities, we are seeing people with a certain level of misinformation being unwilling to take up the vaccine process. So we would also anticipate that we face the same challenges in our correctional centres, and that would be one of the things that we really focus on to ensure that we reach some level of population immunity, at least in our correctional centres, so that we can resume to normality as much as possible.
So you've approved 90 vaccination sites across the country, and do you have a set of criteria, as we've seen with the general public, in terms of how you would phase this particular process for inmates? And does this include awaiting trial inmates?
The remand detainees would also be included, although it would be a bit tricky with remand detainees because in their case, it's a matter of time before they are probably released back into society, either on bail or they could be acquitted at any moment. So their time with us is quite limited, or it could be longer. It's really a case-by-case analysis. But in general, we will not be having a specific criteria to limit individuals, because given the confines, institutional spaces that we have, time is of the essence. The quicker we are able to vaccinate everybody, the better. But initially, we had started off just with the over 50 bracket when everyone else in society was being vaccinated at the over 50 bracket. And under that, we've also seen a good take-up from our inmates. Over 1,000 also have been vaccinated under that bracket. But generally, anyone who is eligible to be vaccinated, who is in a correctional centre, will be eligible to be vaccinated. So, and this is because, like I've said, time is of the essence. We need to ensure that everybody gets vaccinated so that we can resume normality as much as possible in our correctional centres.
With regard to prisoners who are studying, for example, towards their matric or degrees or whatever it may be that they've chosen to study towards, has that been impacted by the pandemic?
It has not been relatively impacted. They still have access to all the study materials that they are required to have access to. And we still have educational facilities as well. We have our educators coming in, and they too are a priority for vaccination because they interact with inmates. They also interact with community members. So systems are in place to keep a level of normalcy in that regard. And in fact, we've even seen, as you would have seen last year, an increase in our matric results. So there's not been actually a very dire impact on the educational facilities and the ability of inmates to study.
And then we've also seen, Chrispin, some members of the public, and I'm sure as Correctional Services, as a department, you've heard some of these murmurs, read some of them, where members of the public have expressed displeasure at the fact that inmates will be vaccinated while most of the general public have not been prioritized. And just in terms of, your response to something like that, a sentiment being expressed to that degree.
I think it's a bit of an unfortunate sentiment because people think that we condemn inmates forever in our correctional facilities, and we must understand that these inmates one day will come out and they will live amongst us as different people, and so we need to ensure that when they do come back, they come back in a condition that they are able to participate in our communities. But also, like we say, if you look at the population rate of our inmates vis-a-vis the population of the country, it's a negligible amount of people who are getting vaccinated. But over and above that, no one can really show that they are given preferential treatment because, as we speak now, we're speaking of over 5 million people being vaccinated in the country. Then only we then move into the correctional centres. And also given, most importantly, the institutional confines of a correctional centre, if we do not vaccinate people in correctional centres, it will have a direct impact on our communities because officials interact both with inmates and our community members. And so a super spreader in a correctional centre can easily have a major impact in any community directly. So it's in the best interest of our communities that inmates are actually vaccinated to prevent fatalities both in correctional centres but also in our communities.
And also, just to reiterate, you did also stress that inmates, of course, have the right to refuse a vaccination. It is their constitutional right. But just looking at the protocols, the processes, when someone is incarcerated at this point, we saw, for example, when former President Jacob Zuma was incarcerated, we were told he's going into an isolation facility. So what is that protocol generally for inmates?
Sakina, it's very straightforward. Once an inmate is admitted into a facility, they are screened, but also they are placed under isolation in a different part of the facility for a period of 14 days, and they are monitored for symptoms of COVID. And if they do then have COVID symptoms, they are then, if they do have COVID, ultimately they are then quarantined and then given the necessary protocols to ensure that they recoup and recover within a probably 14-day or 10-day period, as the case may be with certain individuals. So it's something that's very standard, but it's done with great rigor in our facilities. An inmate is screened, checked, and then put under quarantine for 14 days, observed. Once we're really sure that they indeed do not exhibit major symptoms of the virus, but also they are COVID-free, they are then assessed by the case management committee, and then they're classified and placed in a particular vicinity or space within the facility, either A, B, or C, depending on the nature of the crimes that they've committed, but also depending on primarily the assessment of the case management committee in the centre.
We're going to have to leave it there. Chrispin Phiri, thanks so much, spokesperson of the Department of Justice and Correctional Services, talking to us about today's launch of the vaccine rollout program for inmates and correctional services officials. And as always, you're more than welcome to let us know what your views are.